So I'm going to take a presentation about in the hyperthermia very briefly. And actually, there are several modalities for anti-cancer treatment. And the major two categories are the local therapy, such as surgery and radiation therapy, and systemic therapy, such as chemotherapy and immunotherapy. And other minor categories are which is arising maybe in decades ago, and the targeted therapy, hormone therapy, stem cell transplantation, precision medicine, biomarker targeted therapy, and which is the hyperthermia and where is hyperthermia located. And nowadays, in the those kind of therapies are really maximized practically, and if we do gain the effect a little bit more, and it's very, very difficult, and it requires a lot of money and a lot of effort like this. So the hyperthermia is a type of cancer treatment in which body tissue is exposed to a high temperature. And research has shown that the high temperature can damage and kill cancer cells, and without injuries to surrounding normal tissues. And by killing cancer cells and damaging protein and structures within cells, hyperthermia may shrink tumor cells and the tumor killing directly. Hyperthermia is under study in clinical studies. And the remission 1 degree by RDP lab is a new technology, capacitive resistive electric transfer method. Is a very complex size and cost effective, and it enable deep heating, and we can get a very uniform temperature through a whole tumor volume, and it's proved with a large animal study also. And then look at the first of all cytotoxicity and the physiological change with the hyperthermia. Hyperthermia induced the cytotoxicity. The predominant molecular target of hyperthermia is a protein, and the hyperthermia halts synthesis of all protein except the heat shock protein. So, as you know, in the heat shock protein is a very important key molecule for thermal tolerance, and hyperthermia also alter organelles and its functions, especially in the modifying the cell membrane lipid content and the changes cytoskeleton of cells, and induce metabolic enzyme and decrease DNA repair protein, resulting in tumor suppression. Hyperthermia enhances a drug delivery to tumors, and it makes the AV shunt thrombosis, the leukocyte plaque, RBC rigidity, and the cellular cell swelling, and it makes the loss of endothelial cell basement membrane integration along the vessels. Usually, hyperthermia may enlarge endothelial gap and resulting in hemorrhage. This kind of effect was maximized, and the temperature between 40 to 42 degrees Celsius. The left side picture is a normal blood vessel in normal temperature, and during the hyperthermia, properly, there maybe in the mild hyperthermia, at the temperature between 39 to 43 degree, and the blood vessel enlarged and swollen like this, and it's very good point to increase the blood vessel, and very ideal for drug transportation into tissues and the tumor, and over temperature over 33 degree, and the blood vessel shrink again. In vascular level, and hyperthermia increase the blood flow and vasodilation, vascular permeability, increased pH, increased oxygenation. In cellular level, in the hyperthermia, the nature of protein and the impaired DNA repair. And we must look at the hyperthermia and our immunity. In our body, there are two different types of immunity. The first is innate immunity by natural killer cell, and another one is adaptive immunity. The antigen is presented through dendritic cells, and that makes induce the cytotoxic T lymphocyte. That's adaptive immunity. Diane reported hyperthermia increased NK cell activities. He found out in the fever range level hyperthermia, the temperature is just 40 degrees Celsius more or less. Enhance the human NK cell cytotoxicity against the tumor target cells. There are balance between the inhibitory pathway and the stimulatory pathway between NK cell and the tumor cells. If hyperthermia hit NK cell and tumor cells, both of them, and the NKG2D receptor of NK cell combined microligand of tumor cells, that's a stimulated pathway. Under this situation, in the NK cell kill the target tumor cells. That during this kind of procedure, the antigen from the tumor cells is transmitted to AP cells or dendritic cells through heat shock protein 70. So we know originally we know the heat shock protein is a induced thermal loss, but he found out the heat shock protein also give some kind of effect to induce adaptive immune system. So we know the heat shock protein have a bilateral effect on the cancer cells. Here, they are published in the hyperthermia increase various type of immune system, including an NK cell or dendritic cell, polymorphic nuclear cells, and various type of immune systems. Okay, now I show in the clinical trials a couple of cases. Actually, those are not my cases, but they are very important in hyperthermia history. The Japanese doctors Sugimachi published the esophageal cancer randomized trial with hyperthermia, 1994, International Journal of Hyperthermia. 40 esophageal cancer was randomized. Group 1 is only chemotherapy, and group 2 is chemotherapy and hyperthermia. After induction therapy, all of them got the esophagectomy, and the pathology result after esophagectomy show better result in chemotherapy and hyperthermia case. So the conclusion was the clinical and the pathological effect were favorable in hyperthermia combined with chemotherapy. Especially in those cases almost were advanced esophageal cancer cases. Now, ISU published the hyperthermia effect with the soft tissue sarcoma. He reported the first result in year 2010 in Lancet Oncology, and after that he published a long-term final result in JAMA Oncology year 2018. Originally, 341 soft tissue sarcoma patients were randomized. The group 1 and the chemotherapy only. Group 2 is the chemotherapy and hyperthermia. And after induction, and that they got almost in the surgery and or radiotherapy. After that, they continue the second induction after surgery or radiotherapy. This is a patient characteristics. At the first publication, and the better results show in the hyperthermia and the chemotherapy group for local progression of free survival and the local recurrence rate, and except the overall survival. But they analyzed again overall survival. The reason why in some patients did not complete the whole treatment procedure. So out of the patients who take a whole complete treatment procedure, and they reanalyze the overall survival again. This overall survival showed the better result in hyperthermia and chemotherapy group. And hazard ratio favor hyperthermia and chemotherapy. So this randomized trial provide the first evidence that the regional hyperthermia and pre-op and the post-op chemotherapy clinically more effective than chemotherapy alone. Year 2018, they showed a long-term result in this report. They showed better local progression-free survival, disease-free survival, and overall survival also, and they showed a better hazard ratio in hyperthermia and chemotherapy group. So patients with localized high-risk soft tissue sarcoma, the additional regional hyperthermia to neoadjuvant chemotherapy results in increased survival, as well as local progression-free survival. So in conclusion, hyperthermia is killing tumor cells. Hyperthermia induces cytotoxicity, and hyperthermia is very sensitive to DNA synthetic phase. And hyperthermia enhances drug delivery into tumors, and enhances the reoxygenation, and increases DNA damage, and inhibit the DNA repair. So, and the hyperthermia increases the immune system. So, the hyperthermia is a very nature-friendly treatment and no accumulating toxicities. And we can repeat hyperthermia without limitation. And the hyperthermia can be combined with any other standard treatment. And hyperthermia increases our whole immunity. It's very much beneficial combined with the other treatment therapy, which is usually decrease our immune system. Thank you very much.